slide. And now I'm going to turn it over to Melissa DeHaan. She is the Perinatal Hepatitis B Prevention Program Coordinator for Texas. And we look forward to hearing from her. Melissa?
Thanks, Lisa. Good morning from Austin, Texas. Thanks for inviting the Texas Perinatal Hepatitis B Prevention Program to participate in this webinar. My name is Melissa DeHaan, and I work for the Texas Department of State Health Services as the program coordinator for the state. I'm going to mainly discuss our program's educational efforts to prevent mother-to-child hepatitis B transmission, as well as our promotional efforts on the universal birth dose. So just real quick, I think we've gotten the history of the overall perinatal hepatitis B prevention program, but in Texas, we started our programs in Harris, Tarrant, and Dallas counties, and two cities, San Antonio and Houston, in 1991. And then in 1999, our governor, George W., signed legislation requiring hepatitis B screening for all pregnant women at first prenatal appointment and at delivery. And then by 2001, the Texas Department of State Health Services had expanded programs to cover the entire state. Next slide, please. So just in general, Texas is a big state, and you all are aware of that, I'm sure. We have a population of over 29 million, with 6.2 million being women of childbearing age. We have some very large metroplex areas like Houston and the Dallas-Fort Worth area, with over 15 million people combined in those areas, plus San Antonio, Austin, El Paso, adding another 6 million. That leaves about 8 million people spread out over a very large physical space. And some areas with our sparse populations and large spaces have very limited resources and knowledge about hepatitis B and then how to handle pregnant women with hepatitis B. Texas shares long borders, and a lot of them, with neighboring states and Mexico. Women in the program can be living in one state and getting prenatal care in another, which requires a lot of close collaboration with neighbors. And we have a very diverse ethnic population, with a majority of our foreign-born residents coming from Latin American countries and 24% coming from Asian countries. Next slide, please. So how do we staff this state with its various areas of density and ethnic composition and service availabilities? So as you can see on this map, we have 8 public health regions that are managed by 5 Department of State Health Services regional coordinators, all of whom are nurses. And here you can see we've got 1, 9, and 10 clustered together, and that's West Texas Panhandle. 2, 3, 7 is our Dallas, Fort Worth, and Central Texas areas. 4, 5, 6 covers the eastern part of the state. Region 8 is San Antonio and surrounding areas, and then Region 11 is South Texas. In addition, we have 46 contracted local health districts within these public health regions that are grantees and have staff working cases as well. And then Houston and San Antonio are individual grantees with the Centers for Disease Control for their programs, through their immunization programs. Next slide, please. Because of our state's large layout, real quick on the stats here. I forgot about that one. As you can see, I've got our 5 years of data from our Peri-Hep B program volume. The blue bars represent the number of perinatal hepatitis B positive women that we're case managing. And then the yellow line indicates I think the graph got shifted a little bit. The line got shifted a little bit. But the percentage indicates how many of those women received the appropriate post-exposure prophylaxis at delivery. Next slide. So because of our state's large layout and the many people involved in the program, as outlined by the map and our populations, we need to focus on education with our enrolled mothers first. That's what we can really control, is speaking with our moms. We focus our educational interventions in a way that will help the birthing facilities better manage that birth dose administration. As mentioned by Dr. Hagemeyer yesterday, the birthing facilities can be extremely busy and lack the time to provide the education during a very eventful shift or during a very complicated delivery. And we want our enrolled moms at delivery to understand exactly what's going to happen when they have their baby, to prevent hepatitis B, and to be fully invested in that process of administering that birth dose and the immunoglobulin, because she wants to keep her infant healthy. But not all of our field staff are clinical. We hold monthly meetings and then intermittent check-ins to assist them with their case management. But all of our regional coordinators are nurses, and we have nurses at our central office staff that can step in to lend another hand to have conversations with moms or dads about the Hep B care. As mentioned before, nursing staff always is available to step in to do more counseling, and we are developing materials that will give parents the tools to better communicate with their different care providers. And sometimes there's many different people involved in the pregnancy, the delivery, and the child care afterwards. So what we're looking to design, and we have some designs already, is a postcard for mom to bring to her obstetrician to advocate for the appropriate testing and treatment in the prenatal period, including the DNA level checks and antiviral treatment, and then to bring a note to her delivery facility to inform them of the prenatal hepatitis B labs that have been done and the treatment she has received during pregnancy, and then another card to bring to her pediatrician after delivery to inform them of the baby's exposure at birth and the appropriate care and blood testing after. And then we want our care to be family centered. You know, if our mom, and this is, getting into some community organizing and other of the softer subjects, but if mother prefers to chat via the text, we do that. If the father of the baby is involved as well, bring them in. If the mom prefers that we talk to grandmother about what the vaccines are needed, educate grandmother. So we're doing constant education to all of the members of the household and helping them to get linkage to care where needed. Next slide. So teach the clinicians. As part of our program evaluation, our grantees are required to provide a quarterly education piece to some participant in the program in their respective area, such as a pediatrician's office, a delivery facility. And with that size across the state that we mentioned and the number of cases spread out over all of that space, you can imagine that someone may not see a case of perinatal hepatitis B but once every 10 years. And so they need a refresher, right? It's not something that happens all the time, so you're less likely to be up to date and up to speed. But with our 46 local health departments, 5 regional coordinators, and central office staff, we add up to about at least 200 acts of educational outreach per year across the state. And the opportunities are abundant. We have enough field people to provide the in-person visits with materials. And some areas even have, they have their own funding. They have their own funding to use the funding in the way that they want. So some areas have decided to focus on field nurses that provide education on a variety of topics, including perinatal hepatitis B. The nurses and the clinical staff in the facilities with the pediatricians and the obstetricians are sometimes the one running the office, right? So let's work with them to provide education, to offer continuing education, to provide the materials so that they can let their providers know about what's supposed to happen. We have provided different educational content for different specialties. So for an OB, we try to keep up with the current research, current articles. For the pediatricians, for the infectious disease and hepatologists, to keep them in the loop. And again, we want to reach out to hepatologists and infectious disease providers and practices that have a high concentration of clients with hepatitis B, especially women of childbearing ages, so that they can start that preconception education for women that are planning families so that they know what's going to be happening. And they don't have to rely on the time when they're having a baby to learn about what's going to happen after delivery. And then extra attention to those clinicians that take care of a large amount of our patients. For 2 examples, Vietnamese speaking physicians in the Houston or Dallas area, or providers in the free or the federally qualified healthcare systems. And finally, let's reach out to our midwives. Some birthing centers in Texas don't offer any vaccines. And just in the last 6 months, we've had 2 interactions with practices taking care of a Hep B mom. And we were able to provide them with the Hep B vaccines and the immunoglobulin at no cost. But that relationship with the midwifery office and the midwives within the practice may lead them to think, about at least offering and having on hand that birth dose of Hep B for all of their delivering mothers in the future. Next slide, please. Finally, we want to reach out to the hospital staff. We have over 200 birthing facilities all across the state. And in some locations, it's the labor and delivery person that types in and reports. Sometimes it's the newborn nursery, sometimes the infection control, usually it's the infection control department, but we have some very small facilities as well that don't have a lot of specialized positions in the facility. So we are working to have contact, a very good contact at every single birthing facility so that questions can be answered and timely reporting can be completed and education can be provided. The Women's Health Service Directors have that authority to step in when there's bigger changes such as practice change, reporting change. We can assist them with developing standing delegation orders or policies that allow for the better birth dose coverage. And we also want to know our lab managers because some of our rural facilities send out tests with a very slow turnaround, or there's questions about what happened with some indeterminate test results. So having at least one good contact at each facility can be a big support to making sure babies get the treatment they need at birth. Next slide, please. And finally, some other educational opportunities. We have a lot of military bases in Texas, and a lot of them are staffed with their own public health nurses, and making contact with them, detention facility staff, and connecting with the healthcare support within those facilities, and then groups that focus on the hepatitis B education in their specific communities. Next slide, please. And that's it. Thank you so much.